Hey everyone, welcome back to Dr. Tripathy YouTube channel.
Imagine a life-saving treatment, a procedure so powerful that it can reset the body's immune system and offer a second chance at life. That's the remarkable potential of a bone marrow transplant. For patients battling serious blood diseases and cancers, a bone marrow transplant can be a beacon of hope, a chance to overcome their illnesses and reclaim their lives. This complex and delicate procedure involves replacing damaged or diseased bone marrow with healthy stem cells, the building blocks of our blood and immune system. These transplanted stem cells have the remarkable ability to rebuild the bone marrow and restore its vital functions, giving patients a new lease on life. When it comes to bone marrow transplants, Mayo Clinic stands as a global leader, a beacon of hope for patients seeking the best possible care. With a legacy of pioneering research, exceptional clinical expertise, and a compassionate, patient-centered approach, Mayo Clinic has earned its reputation as a trusted destination for this life-altering procedure. For decades, Mayo Clinic's dedicated teams of hematologists, oncologists, transplant surgeons, nurses, and support staff have been at the forefront of bone marrow transplantation, pushing the boundaries of medical innovation and providing unparalleled care to patients from all walks of life. Bone marrow transplants are a complex medical procedure that involves replacing diseased or damaged bone marrow with healthy stem cells. These stem cells, responsible for producing our blood and immune cells, are like the seeds that replenish our blood and immune system. The goal of a bone marrow transplant is to replace the unhealthy bone marrow with healthy marrow, allowing the body to produce healthy blood cells and strengthen the immune system. There are two main types of bone marrow transplants: autologous and allogeneic. In autologous transplants, patients receive their own stem cells, which are collected before high-dose chemotherapy or radiation therapy. This approach is often used for patients with certain types of cancers like lymphoma or multiple myeloma. In allogeneic transplants, patients receive stem cells from a donor, usually a sibling, parent, or unrelated donor found through a registry. This type is used for conditions like leukemia, aplastic anemia, and certain inherited blood disorders. The choice of transplant type depends on the patient's specific condition and overall health. Mayo Clinic's bone marrow transplant program is renowned for its expertise, boasting decades of experience and a commitment to cutting-edge medical innovation. The multidisciplinary team at Mayo Clinic has performed thousands of transplants, accumulating a wealth of knowledge and expertise that translates into better outcomes for patients. Mayo Clinic's commitment to research is evident in its numerous clinical trials, constantly exploring new frontiers in bone marrow transplantation. From developing innovative transplant techniques to refining donor-matching processes, Mayo Clinic is dedicated to improving the lives of patients through groundbreaking research and clinical practice. Section 5. The Transplant Journey at Mayo Clinic, a step-by-step guide. The journey of a bone marrow transplant at Mayo Clinic begins with a comprehensive evaluation process. This includes, a thorough medical history review, physical examination, blood tests, imaging scans, and sometimes a bone marrow biopsy. This evaluation helps the team determine the patient's suitability for a transplant and develop a personalized treatment plan. Once a patient is deemed eligible for a transplant, the next step is conditioning. This involves high-dose chemotherapy or radiation therapy to eliminate the diseased bone marrow and prepare the patient's body to receive the new stem cells. For patients receiving stem cells from a donor, meticulous donor matching is crucial to minimize the risk of complications. The actual transplant procedure is relatively straightforward, resembling a blood transfusion. The healthy stem cells are infused into the patient's bloodstream through a central venous catheter. These stem cells then travel to the bone marrow and begin the process of engraftment, creating new, healthy blood cells. Post-transplant care is critical for monitoring engraftment, managing side effects, and preventing complications. Patients typically stay in the hospital for several weeks after the transplant, receiving close monitoring and supportive care from a dedicated team of healthcare professionals. Section 6. Comprehensive Care at Mayo Clinic, a team effort. At Mayo Clinic, the bone marrow transplant journey is not just about the procedure itself, it's about providing comprehensive, patient-centered care every step of the way. The multidisciplinary team at Mayo Clinic works collaboratively to address every aspect of the patient's physical, emotional, and social well-being. From dedicated transplant coordinators who guide patients through the entire process, to social workers who provide emotional support and resources, the team at Mayo Clinic is committed to making the transplant journey as smooth and successful as possible. Section 7. Who can benefit, conditions treated, and eligibility criteria. Bone marrow transplants are a life-saving treatment option for a wide range of serious blood diseases and cancers. These include leukemia, lymphoma, multiple myeloma, aplastic anemia, sickle cell anemia, thalassemia, and certain inherited immune deficiencies. Eligibility for a bone marrow transplant depends on several factors, including the patient's overall health, age, type and stage of disease, and the availability of a suitable donor. A thorough evaluation by the transplant team is essential to determine if a bone marrow transplant is the right treatment option for a particular patient. Section 8. Outcomes and Success Rates, a testament to excellence. Mayo Clinic's bone marrow transplant program boasts impressive outcomes and success rates, a testament to the expertise and dedication of the transplant team. While outcomes can vary depending on the patient's individual circumstances, Mayo Clinic consistently achieves higher than average survival rates for various blood diseases and cancers. The program's success can be attributed to its comprehensive approach, meticulous donor matching, advanced transplant techniques, and unwavering commitment to patient care. Mayo Clinic's dedication to research and innovation constantly pushes the boundaries of bone marrow transplantation, leading to improved outcomes and a brighter future for patients. Section 9. A future filled with hope, embracing life after transplant. A successful bone marrow transplant can be truly transformative, offering patients a new lease on life and the opportunity to embrace a future filled with hope. While the recovery process can be challenging and require ongoing monitoring and care, many patients go on to live full and active lives after their transplants. For more information on bone marrow transplants and the exceptional care provided at Mayo Clinic, please visit their website or contact their transplant team. Your journey towards a healthier future could begin with a single phone call.